Hey mental workers, you're listening to the Mental Work Podcast, the podcast about working in mental health for early career mental health workers. I'm your host, Bronwyn Milkins, and today we are talking about moving to Australia to practice psychology and imagery, rescripting and reprocessing therapy. It's a mouthful and they seem unrelated, but as we'll see in this episode, they are very much tied together. Here to help us out is our wonderful new guest, Samantha Duroska. Hi, Samantha.
Hi, Bron. Thanks for having me.
Could you please start us off by telling listeners who you are and what your non-work passion is?
Yes, sure. So, my name is Samantha Duroska, and I'm a clinical psychologist and board-approved supervisor and the director of reprocess psychology, which is my private practice where I focus on imagery scripting and reprocessing therapy. My non-work passion is spending time outdoors, going to some of the beautiful beaches in Australia, going for a hike, going camping. But I also like playing the cello. And as I'm German, I also got into bread making because I really do miss German bread.
Is it different to Australian bread?
It is quite different, yeah. I mean, you can get really good bread here from like good bakeries, like good sourdough bread. But I feel like the variety is bigger in Germany. It's quite dense bread at times, lots of seeds in it. So, yeah, just trying to learn some skills and find the best recipe for doing that at home.
Wow, that's so cool. It sounds like my kind of bread because the only bread that I know that's German is pumpernickel, which I really like.
That's really, really dense. That's true.
Yeah.
Yeah, yeah.
I mean, like, it's not my main bread, but like, I do enjoy it.
Yeah, it's delicious. That's right.
Yeah.
Yeah.
No, and Australia is so beautiful to be outdoors in. I find that a lot of psychologists often like being outdoors because our work is so indoors as well.
That's true. It's so restorative to be outside in nature.
Yeah, I
So
totally
nice.
agree.
Yeah.
And so we've brought you on the podcast today because we're talking a little bit about your journey because you moved from Germany to Australia to become registered here. Is that right?
That's right. Yeah.
Could
Yeah.
you take us a bit through what motivated you to move internationally to Australia and then what the process was like of undertaking your registration?
Yes, sure. So, to be honest, I never really envisioned myself moving to Australia. It kind of fell into place because my partner is also German. And we spent a couple of years together overseas. And then he brought up the idea of moving to Australia. And I thought, well, yeah, actually, why not? Let's just do it. And then I started looking into it. I spent a lot of time looking at the APRA webpage to understand what the process will look like. Started gathering heaps of documents, getting them certified and translated since they were in German and in French. And then eventually APRA approved me as a provisional psychologist. And I had to work under supervision for 12 weeks. And I had to sit the national psychology exam.
Wow. That sounds like a huge administrative load. Like, first off, getting all your transcripts, getting all the documentation, getting them
Yeah.
translated, and I imagine certified as well. How difficult was that for you?
It was really nerve-wracking. Like I felt like I'm doing another degree,
Yeah.
really.
Yeah.
It was really intense. It sounds so smooth if you tell people, yeah, I just moved here and got everything like transferred and am a clinical psych now, but it's a lot of work and effort that goes into that. Yeah.
Yeah, totally. And what
Yeah.
was it like sitting the national psychology exam? Like, did you pass first try? Was it a bit harder? Was it okay?
Um, I did pass first try, and I was really happy that it worked out because it's such a weird
Oh,
exam.
do you think?
Like I felt like they're almost like trick
Oh,
questions and
yes.
really unusual ones, having to memorize different scores from tests. Like that's not really helpful knowledge to know. It was quite different to the test I had to do in Germany to become registered.
What was it like in
But
Germany? Just curious, like, what was the exam like?
they ask for more in-depth clinical knowledge in the exam. But the system is also very different because you do the national psychology exam in Germany once you become fully registered, but you only become fully registered to be a clinical psych.
Oh, gotcha.
So maybe that's just a different system.
Yeah.
Whereas here, like I think every psychologist, even if they're not clinical or they don't want to be clinical psychologists, they have to sit the same exam,
Yeah.
right? So I found there's a different, yeah, they ask for different skill set almost.
Yeah, you're so right because I'm just thinking back to when I did the exam and you just reminded me of like how confusing the questions can be. And you're just like, it seems contradictory here what they are asking me. What is actually being
Yeah.
asked of me? It's just really hard. But yeah, you're right. It's so for psychologists who gain general registration, who go through the 4+2 or the 5+1 pathway, then they have to do this exam. But those who do the 2-year masters do not have to do the exam.
Mm.
But most people need to do the exam.
Yeah, yeah, it's quite painful.
Yeah.
Like no one really enjoys it, right? It's not a pleasant experience.
No, yeah. Yeah, I don't think anybody looks back on it fondly. Yeah. Oh, what a time. I'd love to do the exam again.
Yeah.
Yeah. We could talk about like your boldness and being like, I'm just going to move to a different country. Like, I think that is pretty bold, but you sound like you're pretty self-assured and confident.
Yeah, like I'm really happy here now. Like obviously it's a huge process, and also I've never been to Australia before I moved here.
Yeah.
So it was a big adjustment, and with lots ups and downs. So I guess that's pretty normal. It's a big challenge. But today I feel pretty settled again, and also pretty privileged and lucky that it was as easy as that. Like I'm a permanent resident now. I also applied for a skilled visa. I can practice as a clinical psychologist. So I'm really grateful for that as well.
Well, congratulations. Like, that can be really,
Yeah,
really
thank
hard
you.
and a long journey.
Yeah, thanks.
Yeah. And so, I mean, you've got your own practice here now. Is that as a solo private practitioner or have you got contractors or employees?
No, it's just me for
Yeah.
now. Yeah, yeah.
Yeah.
It's just me focusing on my own clients. That's what I enjoy most, to keep it
Yeah.
very simple and straightforward. Yeah.
And had you had a business overseas or is this your first go at it?
I did have my own private practice in Germany as well, and I think I knew that's what I kind of work best in. That's the setting I enjoy the most. So it was also a goal of mine to work towards that. At first, though, I worked as a contractor in a private practice to get some supervision, to get familiar with the Australian health system.
Yeah.
And then I felt confident enough to open my own private practice again, to go back to the same level of independence that I was used to. So yeah, right now I feel really, really happy running my own business again.
Oh, great. Fantastic. And you mentioned the health system in Australia. I'm wondering whether that was a key challenge for you as well to work out the differences, say, in Medicare as well.
Yes, for sure. Like, on one hand, I love the idea of universal healthcare, but on the other, like, I struggle to wrap my head around how there are only 10 rebated sessions per year. How is that supposed to work, right? I,
Yeah.
I still don't really, maybe it just doesn't, it's not working. Um, but in Germany, clients can access as many therapy sessions as they need, and they are fully covered.
Ah,
Um,
well, that sounds like how it should be.
Yeah,
Yeah.
so that's really a luxury, I think, and really great to have. Wait times are super long though, so I guess that's another consequence of it. But therapy of around 30 sessions is considered shorter term there.
Yeah, it's so nuts. I think you've hit the nail on the head there, which is that I don't think anybody is like 10 sessions is adequate unless you're doing like the shortest of short-term therapy.
But yeah, I don't know. I had some clients, they would see me for up to 2 years and attend maybe 80 sessions, 80, and they wouldn't need to pay anything for it.
Oh, that'd
And
be
they
so
get,
good.
yeah, like you can really do good work and sustainable change and help them. And whereas here it's often more like patching things up, and sessions get spread out throughout the year, so it's hard to really get going and have a good process.
Yeah.
And then only really privileged people can access mental health care services in Australia.
Yeah, it's really sad. And yeah, again, I completely agree with you. It's either we're patching things up and then the person without the 10 sessions gets worse in the meantime, and then they come back again the next year.
Yeah,
Or we're spreading things out so we never get that momentum needed to make the changes that people want to see in their lives.
yeah, exactly. And I also think it has a massive impact on psychologists. Like, I can't imagine how hard it must be for early career psychologists to try to help clients within such a limited amount of sessions. That's
Yeah.
just a lot of pressure. So, I really feel for both clients and practitioners here.
Yeah, me too. Yeah, it is a really sad state. Yeah, I wish that we could go to that German model. It sounds like heaven. It's like, wow, people can get the healthcare that they need to help them sustain and make changes. That
Mm.
sounds great.
Yeah, that's how it should be, right?
Yeah.
Obviously, it also costs a lot of money, like there's lots more taxes and stuff to pay. But then you get this really great mental or general, like health services in general,
Yeah.
and you get help, and it doesn't really depend on how much money you earn. So,
Which is how it
yeah.
should be as well. And like people who have mental health problems might be financially disadvantaged or vulnerable, so then they can get the help that they need too.
That's kind of painful, having to adjust to having just a different setting and wanting to see clients more often to help them better, but knowing at the same time, like I can't put more financial stress on them either by making them come in more often if they can't afford it. So just money plays a big role in therapy here, whereas that's a topic I would never need to discuss with my clients in Germany.
I used to work in a service where we had free sessions. It was government funded for up to 6 sessions. There's still not many sessions, but I still didn't need to think about money. And it was really good not having to think about money and spacing out sessions. I could just be like, we're going to do this amount of sessions. And then moving into private practice and having that just at the back of my mind for every client, it actually does weigh pretty heavily over time.
It does, yeah. And when I trained my supervisors, they would tell me you won't do any therapy before the ninth session because you have up to 8 sessions for assessment only.
Wow.
And then the therapy is supposed to start. But those 8 sessions, they're just to get your formulation right, to get to know the client, to assess it properly. So you have like a lot of time, right? Like if you did not ask a question in the first session, you have many more sessions to ask them. Whereas so you have to kind of hit the ground running and get going pretty quickly.
Oh, you do? Wow. That sounds like a luxury as well. Like, that would have alleviated so much pressure for me because literally I also used to work in another service where it was expected that you would do your assessment in session one. And then only if you had really crucial questions to ask in session two, further assessment questions, would you ask them at the top and then you're hitting the ground running exactly as you say. So it's one session for assessment. And that put a lot of pressure on me. That sounds quite
Yeah.
nice having 8 sessions for formulation
Yeah.
assessment. It's what you need, really.
It is. It's so hard. And I think once you get more experience, maybe you have enough time in 1 or 2 sessions to do an assessment, right?
Yeah.
Like you have more experience and you see things more clearly and quicker and you ask different questions. But when you first start out, it's just so overwhelming.
It is, absolutely. And it's so hard to tease things out. And it's like, oh, this person is telling me about this family. How do I interpret that? How do I work that in into what they're coming to see me for? How do I make sense of this? It's a lot of questioning
Yeah.
going on for yourself.
Yeah, it is. It is. Yeah. So I really feel for Australian practitioners, and I can't really imagine training here. But I'm very glad to be practicing here now, and I think it's just an adjustment to having less sessions and
Yeah.
lower frequency. Yeah.
Yeah, it does sound like an adjustment. And I guess one other thing that we wanted to talk about today, which is perhaps the difference between therapeutic approaches in Germany compared to Australia, is that you mentioned to me that imagery rescripting reprocessing therapy is quite common in Germany. Is that right?
Yes, it is. It's quite common, and most psychologists would know about it or
Yeah.
use it in their sessions. Um, But yeah, moved to Australia and I realized, well, no one really knows about it. It's not very common. There's almost no content in English either. So it's really hard to kind of train in it or just access any knowledge about it. It's quite baffling, really.
Yeah, literally the only time I've come across it is because I did a deep dive into social anxiety. And I remember reading an article about imagery description reprocessing therapy for social anxiety for people who have had like bullying experiences that contributed to that.
Yeah. Ah, interesting. There you go. Interesting.
But
Yeah.
other than
Yeah.
that, I never heard of it, never knew it existed. And so maybe for listeners who are unfamiliar with it, could you please explain what it is?
Yes, of course. So imagery rescripting and reprocessing therapy, in short IRRT, was originally developed in the 90s to help people who experience childhood sexual abuse and physical abuse. And this therapy really helped them to deal with flashbacks and nightmares, and they actually stopped. And then over time, psychologists realized how versatile this method really is. So today it's been used for social anxiety, but also for trauma, for grief, depression, anxiety, and personality disorders. So it's no longer tied to a certain diagnosis. It's more a tool that you can use for also assessment and to help clients access emotions from a different angles, like a different access point, to understand what their inner emotional landscape might look like. And IRT also offers a unique approach to inner child work to help people improve their ability to self-soothe.
And so what does it look like? How does it work?
Mhm.
'Cause
Yeah.
yeah,
It's quite hard to imagine, right? So obviously it's imagery based.
yeah.
You work with imagery. I think most people know what that might look like. And there is a protocol on how to do that, and different protocols depending on the issue, really, or what you're trying to look at. And the language in those protocols is very nuanced because IRT is based on this value of being Socratic, meaning I, as a practitioner, will only facilitate this imagery process, but I won't insert any of my own ideas or content into it. So I think that's a difference to other approaches of imagery work.
Yeah. So, in like, let's say that a client might be filtering out positive information, only focusing on the negative. And from a CBT perspective, you would be like, oh, the cognitive distortion here is filtering. And you might try and work with that. In IRRT, you don't do that.
I would guide the client through the imagery, but I wouldn't say, oh, I think you only notice the negative things here. So I would never correct him. I would maybe mention that as an observation afterwards and to see what their thoughts are about
Yeah.
it. And maybe even record the session so that they can listen in again and kind of reflect back on it and be like, ah, true. And then notice their distortion
That's
themselves.
interesting. Yep.
So
Cool.
it's more like this guiding. It's not like I have all the wisdom and I know what to do here and you should be doing ABC to feel better. It's more like, well, where do you get stuck? Let's move through this process and discover new things that we might not be able to access just by talking about it in our sessions and being quite cognitive while doing that.
So the therapist approach, it sounds like it's non-directive, like pretty curious, helping the client be curious about their inner world.
That's right.
Yeah.
Yeah. Like it's the client's process. We as psychologists, we don't need to understand everything quite yet. It's their process. We move through it. We trust the process. And then we can, afterwards, we can maybe share some interpretations with our clients and see if they resonate. Maybe they won't. And that's it, really. Like, it's not about me saying, oh, you should be saying this to this person in your imagery and to encourage them to say this specific thing. So I think that's the main difference. And also, I think quite helpful for clients because often they might come up with something completely different from what I would envision them doing, right? So to really, it's sometimes quite hard to hold back as a therapist and be like, okay, I'm not going to say anything. I just gonna resist putting my own ideas in there, and it's my job to just facilitate it and hold the space for them.
Yeah, it's so interesting as you're talking about that. I'm like relating to that urge to try and insert my own things into imagery. It's like I
Yeah.
might be like, oh, I think you could use a hug right now, like in the imagery. And the client's like, I want to eat ice cream. And I'm like, okay, yeah. And I'm like,
Right.
no, you need a hug. But it's so hard
Yeah.
to like hold back from that.
Yeah, I think you can really notice how impatient we can get, right? Like we
Yeah.
want to get a good result for the client and
Yeah.
move forward, but to really sit back and sit tight and let them do their own work in their own pace and
Mm.
find their own solution, which I think is much more sustainable than encouraging them to do something. And then they might feel maybe forced to do something, even though it doesn't feel right. And it's not the effect or not the, it's not the progress or process that they needed.
Yeah, absolutely. And I think one aspect that I wanted to pick up on as well, because I mentioned off air to you that I'm a certified schema therapist. So I use imagery rescripting and schema therapy. And I just wanted to check if it's similar in this way. So one way that I might use imagery rescripting and schema therapy is that I get the client to go into an image as a younger version of themselves. And then I get them to explore the image from the perspective of their young child self. And then I might get an adult version or a current version of them to go into the image and provide what the younger version of themselves needs. And so from a schema perspective, that helps us identify what the younger child missed out on and what they need, and it helps them to reparent themselves. So that's the schema language of that, and help them self-soothe. And I just wanted to check, is that similar to IRRT or is there a difference?
It can be similar. So when we look at traumatic events, it would be a similar script, I think. So in IRT, there are 3 steps. The first step would be the client recalls the traumatic event and relives it. So that's
Yep.
the imagery part. And then the rescripting part starts where the adult self would enter the scene, for example, and confront and disempower the perpetrator. Then again, it's Socratic, right? Like I just guide them through it. That's where the language is quite nuanced, to not put any content in. It was quite hard at times not to influence the progress while still holding the space. So to be quite neutral in what we're saying, and also to deepen the emotional experience. So that's step 2. And then in step 3, they would as well soothe their past self and provide what they need and what their intuition might tell them. What then often happens, and maybe that's also a bit different, is that sometimes clients then enter a different kind of conversation, which no longer has anything to do with the specific situation.
Oh, interesting.
So that's where IRT says they also do separate inner child work, where they work with the metaphorical child instead of the biographical child. So I think that's quite unique because it's not about, not depending on the situation and the protocol, but it's not always about the actual situation back then. Sometimes it can be about connecting with your inner child today. So it's more of a metaphor.
Yeah, that is unique because in my training for schema, after we've got the corrective emotional experience that the adult has given the child, I was told in my training to cut it off. Okay, and we exit the image. So we don't have that space, like you just mentioned, to go on to a different scenario that might be unrelated.
Yeah, and like the founder of RRT says he did not how did he say it? He did not invent this method, he found it.
Yeah,
Because
interesting.
doing this work with trauma patients or people with PTSD, he just noticed at the end they often enter a different area, different scene. There's like some deeper conversations with themselves that is detached from the actual traumatic event. And then they started doing more inner child work and used that as a tool in itself to deepen this experience. So we wouldn't cut it off. We would see like, is there anything else? Like what else comes up? Like once now we might feel safe and secure. Is there any impulse to do anything or say anything? So it's completely open. And also in RT, there's no goal, right? When you say you reach a certain emotional goal in imagery scripting, we wouldn't have any specific goal really for a client. I think that's maybe also what makes it a bit more relaxed for clients and practitioners because there's nothing you need to achieve. There's nothing specific you need to prove or show. It's more of an exploration and being curious and taking your time, which doesn't mean it takes longer. I don't think it takes longer than doing it guided, but it's just finding their natural pace to access certain emotions or to understand certain things they couldn't previously understand.
Yeah, that sounds nice as well because in schema it's definitely goal focused. So the goal of the imagery rescript might be that I really want the client to develop further self-compassion for themselves or develop more courage, or to use their wise part of themselves to draw them out in this situation. So yeah, that's really nice. It's exploratory. It's really the client, yeah, sorting out and having a look inside themselves.
Yeah, and previously I did do schema therapy with my clients a couple of years ago, and it felt really good. Like I really like this aspect of encouraging them, like let's do this or say this and get going, right? Like it's really empowering to be able to do that. So I get that, but then again, it's about our clients. And sometimes I thought, well, maybe it's more sustainable to actually hold back and let them do the work to find their own words, their own actions, instead of kind of giving them the solution. Then they end up doing it, but there's still something else maybe. Like quite often you can be very surprised what people come up with.
Yeah, absolutely. Well, I think it's very complementary to the EMDR model, actually, like the AAP model, which says that people who are traumatized, they have what's already in them to heal. And
Yeah.
EMDR sometimes is facilitating that inner healing, but they're capable of doing that themselves. And sometimes we have to help remove those blocks, but otherwise, like the brain can heal itself is the kind of theoretical basis.
Exactly. It's the same approach. It's similar. Yeah, it's like the client can be trusted, that they can find their own path. We also don't need to protect them from the worst parts of the experience.
Ah, interesting.
They're able to face it, they're able to work through and reprocess it, which is the first part, right? Like reprocess things and then rescript things if they need rescripting. So yeah, clients are very capable and they always carry a trauma around with them. Like it's always there. So we don't need to protect them in our sessions and stabilize them for a long time. They're quite resilient if you think about it. So yeah, it's a quite empowering technique to use, and that's what most clients say after a session. They're like, "Oh, it was more intense than I thought, but I feel lighter in some way. I feel more empowered, and felt pretty good actually." So I'm quite surprised, like how different they feel about this experience now.
Yeah, I do resonate with that as well. Like with the schema and when we use imagery rescripting, I usually tell clients like it's simultaneously the most emotionally intense thing that we'll probably do in therapy together, but it's also usually the most rewarding in
Yeah.
terms of like that emotional lightness. And people are just like, wow, I just think and feel differently about this.
Yeah, and it feels so real, right? Like
Yeah.
it's just imagery work, it's just in our imagination, but it's so impressive how real it is and what like it provides real change for clients. So it's such a powerful tool. And when I first discovered it, I was like, oh wow, like that was the missing piece. I had no idea there was a missing piece. But now I feel like I have a complete toolkit and I can use imagery sessions and kind of enhance their progress or understand things together with them. Like if we get stuck to kind of see, oh, let's use a different access point to get to the core of this. So I think often we might get stuck in sessions by just talking
Yeah,
about
we do.
things.
Yeah.
And instead we have to get uncomfortable, do some imagery work, for example, and really explore what is this about? Like why doesn't it help to talk about it in therapy or maybe with friends and family? And it's still an issue. Like what exactly is it?
Yeah, it's so true. I just like, whenever I do my schema supervision, sometimes I go in a bit guiltily because I'm like to my supervisor, I've just been talking too much rather than doing the techniques. I'm sorry. And I don't because it's uncomfortable for me a little bit to sit with
It
that
is, I
discomfort. And so, but
know.
it's so much easier to talk. And I'm like, I'm sorry, I've been talking about the things. I'm like, I'll do better. Yeah.
And I think I did a similar thing, and that's I think why over time I stopped doing schema therapy, but because I often found myself talking about different modes,
Yes. Yeah. It's so easy to get stuck in that.
and it's so interesting, it's fascinating, and it's a great model, and it works so well. Um, but then again, like having used IRRT, I was like, oh, actually, that's all that I need in therapy to plug it in into my sessions. And you can use it with psychodynamic therapy, with CBT, like it works very well, and to kind of enhance the process a bit with it.
Yeah, absolutely. So, what drew you into specializing, I guess, in this therapy in particular? Like, were you drawn to it for the reasons you just mentioned, like the missing ingredient, or was there something else?
Yeah, I think a supervisor introduced it to me, and then I started reading the book and kind of learned more about it and started using it. And I was really fascinated by it in sessions. But like, oh, now we get talking. Now we can see things that we were trying to understand, but we couldn't quite get there just by talking about it. So I was like really, really really fascinating. I read all the books and had supervision on it, did the workshops to kind of learn more about it. And I think what I love is having a clear structure on how to do it, having a protocol, while still having enough room for creativity and curiosity. I really love the Socratic approach as well. Like there's no expectation, and I don't know the answer, and to trust the process, to trust the client, and to guide them through it. I think that's just a wonderful tool to have, both for clients and for practitioners. And it's so, in some ways, it's also so simple. I think maybe that's where I, at some point, thought, oh, chemotherapy is so bulky and complicated. And
Yes, it
sometimes I
is.
feel like, oh, I just kind of fail at it. Like
Yeah,
there are so many different things I
it's
should
so true.
consider. Um, Whereas IRT is very forgiving. Like even if you say, maybe say a question during the imagery work that's not perfectly correct, it doesn't really matter. Like it's very forgiving, and clients still follow their own path and process. And that's also the attitude of the founders of this technique. Like it doesn't need to be perfect, and the clients will find their own way. Like it's just about opening up this room and guiding them through it. So yeah, I really enjoy using it, and I wish that it could be more popular in Australia as well.
Yeah, like I said, I've never heard of it like aside from an article or two or a mention in a
Mm.
textbook. But now what is popular in Australia is chemotherapy and EMDR. So, I mean, I heard you mention the IRT is really good for trauma. So it's a trauma modality in itself. Is that right?
It was first developed to help with PTSD,
Yeah.
but today it's been used similarly to EMDR and schema therapy for a very wide range of issues. And interestingly enough, there are even clinics in Germany that specialize in this technique because it works so well, and they mainly focus on trauma, so they're trauma hospitals. So it's really, really popular and very common and well known. And there's also research that shows that it is as effective as EMDR. So the evidence is there. I just think the main downside is that all the literature is in German.
That would be the barrier because I would be like, I'm like, why isn't it more popular? I'm like, why aren't people learning
Yeah,
this? Because it should be. It's like it should be on parity. If something is just as evidence based, then we should hear about it. And then I feel like it offers clients more choice and control about the type of treatment they enter when we've got those options available to them. Um,
absolutely.
so
Yeah.
yeah, that sucks because most of us. I mean, if all Australians were bilingual in German, it wouldn't be a problem.
Yeah, but it's too
Yeah,
much to ask for, right? Like you can't
yeah,
expect people to read a book about trauma therapy
yeah.
in German. That's just quite hard.
That's such a shame though that it's yeah, it might be inaccessible in that way. Given that we've got schema therapy and EMDR, and I think a lot of early career psychologists and a lot of early career practitioners feel quite pressured to specialize in these therapies. And I wondered what your perspective on this was.
Yeah, I noticed that, and I again feel like it's not necessary, right? Like there's enough pressure already on early career psychologists, especially. And I would like to tell them you can just take your time, and you can experiment, and you can also change your preferred technique if you need to. You also don't need to upskill right away. Like you definitely also don't need to be certified in every other modality just to be qualified enough and to be a good enough therapist. Like you can delve into some different techniques, use them, try them out, see what suits you as well, um, and what suits your personality. I think that's also a good burnout prevention to choose something that really suits your own perspective on things, that really clicks with you. So don't feel pressured, take your time and explore what else there is besides from schema therapy and EMDR.
I think that's such a nice and reassuring perspective to hear because I think a lot of listeners who are early career will definitely resonate with that feeling of pressure to get trained in all the therapies, get them all
Yeah.
straight away. I got to be certified in this and this and this. And it's like, you know, speaking from personal experience as well, it just feels like you need more tools in your toolkit straight away.
And from research, we know it's not really about having all those different toolkits. We know it's the therapist that makes the difference,
So true.
right? So to kind of sit tight and remember you're skilled enough as a registered psychologist. There's no need to spend so much money on those trainings as well. At least that's my point of view. And to just take your time. And if you want to specialize and focus on something, go for it. But like you can also take your time and just see what works best for you.
Yeah, absolutely. I think it's really important as well. So, like for Australian psychologists, we've just gotten these new code of ethics, and one of the competencies that's been added is deliberate practice. And I think that's really good because it speaks to what you're saying about like you can improve how you are as a practitioner by focus on these skills that you already have. Like you don't need to spend $5,000 on the latest, most expensive training.
Exactly. I think that's so important to remember. I guess once you finish uni, you kind of feel like you just keep going, right? Like you chase the next degree, the next certification. But it needs to end at some
It
point. But you
does. Yeah.
just need to sit in your therapy room, slow things down, and feel what is actually going on here, and maybe practice some soft skills as well. And deliberate practice is the perfect example for that to really work like small things out step by step instead of buying into all those marketing strategies that you need to upskill straight away. And also, maybe it's also quite competitive between psychologists, and you might feel like you have to because otherwise they all have their certifications and I will miss out on it. But I don't think it's true.
Yeah, you're right. I think there can be a perception of pressure that maybe doesn't necessarily match up to reality. And I know from like my own personal experience, like early on in my career, I saw a huge leap, I think, in my practice when I focused a lot on attuning with my clients. So something that I really tried to focus on was trying to get on the same page with my clients about what was happening for them and what they hoped to get out of therapy, and just really getting into their inner world about what was painful for them and what was making things difficult for them to get to where they wanted to be. And I found that focusing on that, like consistently, maybe 3 to 6 months, I saw, I didn't learn a single technique, but I just tried to get on the same page. And I think I saw massive improvements.
Yeah, and I'm sure your clients felt the difference as well. Because there's someone who's actually really listening and tuning in instead of
Exactly.
someone thinking about, which tool could I use next now,
Totally. Yeah.
right?
Yeah. Because I had so many clients be like, please don't give me a worksheet. So I was like, okay, I'm just going to focus on this. Yeah.
I can relate to that, yeah.
Yeah. Was there something in your practice where like you didn't need further training and you were just like, I'm just going to focus on this like air quote soft skill, and that really helped you?
Yeah, I think also something like how to start a session, right? Like how to end a session, how to be on time. That's super important. And I think those like maybe more invisible skills that we can't put on our homepage as a shiny, fancy therapy technique are just as important as knowing your techniques, because obviously it's just not just about listening, it's also about having enough knowledge and tools. But I think we might need way less tools than we think we need. So to kind of choose the right ones for you and to maybe stick to them for a number of months or maybe years, and then to see what else is there. Is there anything else you struggle with? How could you go about it? But to really slow things down and make things simple. Like it doesn't need to be complicated. No one wants to go to therapy and do something super complicated, right? Like it needs to be simple, both for clients and for practitioners.
Yeah, absolutely. Gosh, I bet your supervisors just love your chill approach. It's like, I'll go to
Yeah,
Samantha and I feel better about myself.
yeah, yeah. I hope they do. I hope they do.
Do you think that IRRT training could be more accessible in Australia? Like, are you working on German translations for us?
I will say, like, I recently started my first Instagram account to share more insights into RT and to make it more popular. And then I hope that the books will be published in English sometime soon. I'm not sure when that will be, but we'll see. And I guess if enough Australian psychologists are curious about IRT, hopefully I can offer some training in the future. My dream is to build a community of IRT therapists so we can learn from each other and to also make this therapy more accessible for our clients.
I think that would be entirely possible because I think like one of the huge shifts to EMDR was in Australia. I think before EMDR, there was a big movement in prolonged exposure therapy. And then I think we all got trained in it. I think I just missed that boat. But before me, I think a lot of people got trained in it. And then clients don't respond to it very well. They don't really like repeating and repeating again the precise details of their traumatic events over and over again. And so I think a lot of people went off it, and that contributed to the huge swing to EMDR. But like I feel like IRRT could be a good side or like a good accompaniment, good alternative.
I think so too. I think it's something that's just missing here. Like it's quite accessible. It's quite straightforward. It should be quite easy to learn as well. So I think that's why I maybe also like IRT. It's not as bulky, or there are less gatekeepers. So yeah, we'll see what the future will bring. And yeah, maybe we'll see a lot more IRT therapists in the future.
Yeah, well, do get back in touch with me if you ever do training in the future, and I'm happy to promote it. I'd love it to be more accessible as well.
Yeah, thank you. I'll let you know.
Yeah, please do. And Samantha, what do you hope listeners will take away from our conversation today? What would you like to leave them with?
I think I would really like to encourage listeners to find a tool that suits their personality and that they actually enjoy using, like something that clicks with them, something that just feels quite natural to them, because that's so important, not just for effectiveness for our clients, but also to help prevent burnout in the long run. So that's really important, I think. And if everyone around you is talking about one technique and raving about it, and it doesn't resonate with you, that's completely fine as well, right? To kind of accept that and look into something else. And if IRT sounds like something that might fill a gap in your toolkit, feel free to reach out and see if it's a good fit.
Yeah, and if listeners do want to get in contact with you, Samantha, where can they find you?
So they can find me on my brand new Instagram account,
Wonderful.
which is called Samantha Duroska. But they're also welcome to send me an email to samantha@reprocesspsychology.com.au or visit my homepage for more information.
Great. I'll pop all those links in the show notes. And thank you so much, Samantha, for being on the podcast. It's been so lovely to have you on. I really enjoyed our chat.
Thanks, me too. It was so much fun. Thank you.
Great. And listeners, thank you so much for listening to the Mental Work podcast. If you enjoyed today's episode, do make sure to share it with other people. Chuck it in their ears. It's the best way to get the word out about the podcast. That's a wrap. I'm Bronwyn Milkins. Have a good one and catch you next time. Bye.